come in.
Hi, Miss Lewis. How are you doing today?
I'm doing good. How are you?
I'm doing great. How's Reginald?
He's doing good. He's doing good.
Wonderful. Okay. So I just have some discharge teaching I want to go over. So we'll talk about mom first, you, and then we'll talk about baby.
Okay.
So for you, I just want you to know that, adequate nutrition is good for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowels become regular. Eat foods rich in calcium, which include dark green leafy vegetables, milk and yogurt. Drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain hydration.
Okay.
Avoid soft drinks, coffee, tea, and alcoholic beverages. Gradually increase your daily activities until you're back to a normal routine. Rest frequently, no lifting, pushing, or pulling for the first 2 to 6 weeks or as instructed by your physician. Do not drive until you are released by your physician. Breast care, I know that you had mentioned that you were not going to be breastfeeding.
That's right.
All right. But even so, your breasts and nipples may have changed or grown in size during your pregnancy. Wearing a well-fitted, supported bra day and night may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking. Leaking may occur for several weeks to months. You may apply ice packs between feedings, but you're not doing that, so you're good. To prevent tissue injury, do not apply cold directly to the bare skin. Do not massage or apply heat to the breast. For hygiene, make sure you wash your hands frequently as you are caring for yourself. To prevent infection, always wipe front to back after going to the toilet and clean your bottom with warm tap water using the Perry bottle after you urinate or have a bowel movement. It is important for you to change your pad frequently. Your vaginal flow will decrease in an amount from bright red to pinkish to brown to yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. Avoid constipation. You may take a mild laxative or stool softener until bowel movements have returned to your normal pattern. Increase fluid and fiber in your diet to help that. So for birth control options, discuss those with your healthcare provider. You may choose to obtain a method of birth control before resuming sexual intercourse. And as far as sexual intercourse goes, nothing should go into the vagina for the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and you feel physically and emotionally ready. Warning signs that you should watch out for, and that if you do see, definitely report it to your healthcare provider immediately. Pain, redness, warmth, swelling, drainage, or foul-smelling discharge from the incision or if the incision begins to open, whether you had a perineal laceration or C-section incision. Discharge from the vagina that has a bad odor, severe headache or blurred vision or visual changes. If you have a temperature over 100.4, or if you feel cold or feverish or you have chills, thoughts of harming yourself with baby, pain or burning sensation, redness, warmth, or swelling in the legs. Breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks and flu-like symptoms. Sharp pains in your abdomen, breast, or chest. Trouble breathing, dizziness or faintness. Crying spells or mood swings that feel out of control. Unable to empty your bladder or urination that is painful, difficult, or too frequent. Difficulty having a bowel movement. If you need to report domestic violence or abuse, I'll give you that number to call.
Thank you.
All right, do you have any questions about you?
No, I think I'm good.
All right, let's move on to baby Reginald.
Little Reggie.
Little Reggie, we love Reggie. So for safety, for sleeping, make sure you place Reggie on his or her back to sleep. Use sleep clothing, such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and a safety-proof crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleeping area. The baby should sleep in the same room as the parents, but not in the same bed. And avoid covering the infant's head or overheating. Keep a bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. Clean the bulb syringe well with warm soapy water after each use. Allow it to air dry. Make sure you're washing your hands prior to handling your infant. For car seats, all infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. The use of outdoor announcements is not recommended to announce the birth because it calls attention to the presence of a new infant in the home. Question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risk of SIDS. Now, crying is completely normal. The most likely causes for crying are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feed. Calming techniques include feeding your infant, changing the diaper, gently rubbing the back or tummy, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put your infant in a safe place, take a break, and call a friend. Infants do require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding. You should place your baby on his or her tummy each day for supervised tummy time. This will strengthen his or her neck graft. So, since you are formula feeding, Reggie is receiving a similar or inferior diet. If your baby sleeps longer than 4 to 5 hours and this is feeding, awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. Be sure to hold your infant close while you're feeding. Your infant needs to be cuddled. Never prop your infant's bottle to feed. Infants need to be burped every half ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. It is normal for Reggie to develop a rash on his skin. It appears with small red circular areas with a white dot in the middle. This does not require treatment and will generally resolve within the first week of life. Avoid lotions, powders, and perfumed soaps. Milia are pearly white bumps, usually on the face, especially the nose. They will disappear.
Of those.
Yes, they will disappear within this first week, okay? Jaundice is a common occurrence, so your infant may appear to have a yellow coloring to his skin. It will start in the face and progress down to the toes. If your infant appears more yellow or jaundice in the next 24 hours, you need to call your healthcare provider immediately. When it comes to bathing Reggie, he'll need it to be sponge bath until the umbilical cord falls off. Using a soft washcloth and plain water, gently wash his face. Bathe him from head to toe, saving the diaper area for last. Mild infant type soap may be used on him. So the umbilical cord should be clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within 2 weeks of life. Now diapers. 1 to 2 wet diapers are normal for the first day or 2 of life. Then you should expect to have 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from yellow to green to a mustard yellow and will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. Now, your baby's circumcised.
Yes, he is. Little
So-
Reggie.
Let's go overhead, take care of that. So always wipe baby from front to back. Be sure to cleanse all creases and folds to prevent a diaper rash. Pat dry and diaper. Vaseline gauze is applied to the circumcision with every diaper change for approximately 24 hours. The head of the penis will appear red initially and then it will change to have a yellowish sticky film. This is very normal. If you see any bright red bleeding or green drainage, you should contact your healthcare provider. The plastic ring method of circumcision does not require dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green drainage, you should contact your healthcare provider. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad, and plain water. Dress your infant as you would yourself. Avoid overdressing now. Too much clothing and too many blankets may cause Reggie to become overheated. And Reggie should receive all the recommended vaccinations he can. Okay? And when it comes to Reggie, some warning signs to look out for that you have to report to your healthcare provider immediately. If there's no urine within the first 24 hours at home, this can be difficult to assess, especially with disposable diapers but try. No bowel movement in the first 48 hours. A rectal temperature over 100.4 degrees or less than 97.5 degrees. A rapid breathing rate over 60 per minute or a blue coloring that does not go away. Newborns normally have irregular respiration, so you need to count for a full minute. There should be no pauses longer than about 10 seconds between breaths. Retractions or pulling in of the ribs with respirations. Wheezing, grunting, or whistling sounds while breathing. Odor, drainage, or bleeding from the umbilical cord. Yellow coloring of the eyes, chest, or extremities. Crying, irritability, or twitching, which does not improve with cuddling or comfort. A sleepy baby who cannot be awakened enough to nurse or nipple. Any signs of sickness, like cough, diarrhea, pale color. The baby's appetite or suck becomes poor or weak. And call your child's doctor if you see any of these signs.
We can do that.
Do you have any questions?
No, ma'am. Thank you.
Alrighty, I'll get those discharge papers ready for you.
Thank you.